I'm Gabby Karadka, an 8th semester nursing student, and today I will be explaining how the chest tube works. The first thing I'll do is do my 2 patient identifiers, make sure I provide privacy when I walk in their room, and perform hand hygiene. The next thing, I need to know why my patient is getting a chest tube and how the chest tube works to be able to explain it to my patient. So in my patient's case, they came into the ER with a trauma that's bleeding in their pleural space, so the physician has requested to place that based on their x-ray imaging that came back. The next thing we will do is explain to the patient how the process is going to work. So we will explain that this is placed while they're awake by the physician, and we will also explain that even though they are awake, we will give them some medications for any discomfort that they're feeling. And explain that it is a tube that goes in to their pleural space around their chest, and it will be sutured in with 2 little sutures on either side of the tubing. So this is the tubing that will go in on the side of them, and we will also explain to them that we need to monitor their vital signs throughout, we need to monitor their respiratory rate throughout, and also their mental status. If there's changes for that, we need to monitor. And then we will also now go ahead and explain how the actual drainage system works. So there's this first chamber, which is the collection chamber. That will be documented and monitored all shift, but then documented once a shift. So we will go ahead and put a line wherever the drainage is and date and time and initial it, so we know how much the output is for that shift. And then we have our water seal chamber down here. This, we want to make sure we're watching for any signs of air leaks or titling that's going on. And then right here is our suction. This will be attached to the wall suction. We need to make sure that we have the thoracic suction kit that actually hooks up to here for the wall. Next, we're going to do some teaching for our patient. We're going to explain that they need to use their call light for any type of assistance going to the bathroom, repositioning, toileting. We don't really want them to get up without our help because we don't want them risking the chest tube coming out or the sutures breaking. The next thing we will also do is explain to them that they need to let us know and report any signs of shortness of breath and pain that is associated with the chest tube itself. And then the other thing we need to assess and monitor is for crepitus around the insertion site. So we can do that by monitoring their respiratory system and listening to their chest, and then as well as we need to assess their actual drainage and dressing site. Lastly, after all of that said and done, our patients are doing better. We want to explain that usually the chest tube lasts about 2 to 3 days, depending on the patient. Ultimately, it comes down to looking at their x-ray and seeing if there's improvement, and there's also making sure that the lungs are re-expanding. So those are our 2 goals with the chest tube. If that's met, then the physician will discharge the chest tube. He will do it at the bedside, and we also want to make sure that while they have this chest tube, they don't knock this over or empty it themselves. It always has to be what this collection is. We never want them to empty it themselves. So lastly, we will go ahead and just explain all of that and make sure that they understand it, making sure that their mental status is appropriate to actually understand this. And once it is discharged, we can then go ahead and dispose of this properly. We want to make sure we put it in a red biohazard bag and place it in the appropriate dirty utility closet for removal.